It's one of the deadliest cancers, often diagnosed after it has already spread. But doctors are stepping up the fight against ovarian cancer, hoping a new test can help catch it earlier. Channel 2's Sarah Donchi reveals what makes this test different and other ways women can reduce their risk.
They used to call it the silent killer because you usually don't have any symptoms up until you're in very advanced stages.
There's no test for early ovarian cancer, so Dr. Lacey Krebsbach says women who have a family history need regular screening.
The signs and symptoms of ovarian cancer are very vague and they seem like they might not be related, and so it's hard to tease through problems or symptoms that a patient might be having.
Researchers found combining a blood test with ultrasound scans could reduce ovarian cancer deaths by 20%. But Dr. Krebsbach says elevated blood levels aren't always an indication of cancer.
Just getting that as a screening test is not recommended because it could be elevated during certain times of the menstrual cycle, for endometriosis in smokers, people with liver disease, and so it's not as specific as it needs to be.
The biggest risk factors for ovarian cancer are age and family history. With cervical cancer, HPV is the big culprit. And though most diseases can be cleared, there are some aggressive ones that stick around.
Our way to manage that is that we are recommending young women and young men, as young as 10 and 11 years old, to start getting the human papillomavirus vaccine. There are a few vaccines out there, but Gardasil is probably the most well-known.
The idea is to get vaccinated early, before young people become sexually active.
If you come in contact with these viruses, getting the vaccine at that point is not going to be helpful for that specific strain. But since there are so many out there, it still can protect you from some of the aggressive ones.
The HPV vaccine is only recommended up until the age of 26. After that, women can still get the vaccine, though it may not be as effective. Sarah Donchi, KPRC, Channel 2 News.
New research released last month confirms the HPV vaccine has reduced a sexually transmitted virus that can cause cervical cancer by almost 2/3 in teenage girls.